Alright, so I've just performed trach suctioning. So I've already verified all the patient's information, their allergies, and I've removed the gauze out from under the trach. So here I'm going to perform my trach care. First I'm going to perform hand hygiene, and then I am going to go ahead and open my saline. And I'm going to leave that lid up. And then I'm going to go ahead and go into my trach care thing. Kit. And then I'm going to, with my non-dominant hand, put on my sterile gloves. And now that I've got my sterile gloves on, I can touch anything in this kit. So I'm just going to scoop this over here. I'm going to open this up with the shiny side up. And it's going to float away. And then I'm going to get all my supplies out. And I'm going to set these up from what I need the most to what I'm going to need last, or first to last. And that can go over there because that doesn't have to be sterile. And then I'm going to sit this about right here. My Q-tips there. Those. That's going to be last with my V-cut. One dry. And then 3 with, I just broke sterile field by reaching over. And then I'm going to put these in here, folded up in little triangles. And then here's where I'm going to break my sterile field in my sterile in the left hand. And because I'm reaching around, I'm going to lip it in the trash can, and then I'm going to pour halfway full in the first container, halfway full in the second. Set that back over there. Now my left hand's useless, so I'm going to put it behind my back. And I'm going to take these and I'm going to wring them out and put them in here. So then I'm going to, with my non-dominant hand, because it's already contaminated, remove the inner cannula and drop it into there. And because this is sterile, I'm going to move that there. Then I'm going to, oh, I also forgot to wet my brush and my Q-tips before in here and place them in here. So those would already be wet, but I forgot that part. And then I'm going to take this out with my left hand, put that in there, give it a little scrub on both sides, and then scrub on the outside. And then here I'm going to rinse it out. I'm not going to let it go. I'm just going to give it a little swooshing motion. And then I can throw that away. Then I'm going to get my pipe cleaners. And I'm going to fold them to make it a better fit. And then you're going to dry just the inside. And once you're done with that, you can put the inner cannula back in. And we're going to perform the outer care for the trach. So you're going to take one. And here I have my triangle. And I'm going to do one away, one toward, throw that in the trash. One away, one toward, throw that in the trash. And then lastly, one this way and one that way. Then I'm going to use my Q-tips one at a time. And I'm going to clean under and then right around. Throw that away. And then I'm going to go under, and I just broke sterile field by touching that. And then under, and throw that away. And then I am going to use my dryer and go under, over. And then after I'm done with that, now it's nice and dry, I'm going to pick this up with my sterile hand. And then as long as I don't touch that inner V, that needs to remain sterile. So I'm just going to slide this up under. And that's as far as that's gonna go. And then from here, I would tie this off. Since we obviously have these ties already on there, I'm just gonna say that I tied those off. Those don't have to be sterile. And you also don't remove the ties until you have the next ties strapped in already. After that, then you will also hook them back up to oxygen, which I forgot to state at the beginning, but you will obviously remove their oxygen. But you'll put their oxygen mask back on and clean up, and then perform hand hygiene, document bed and lowest position, side rails up, and call out and reach.